This video will show you step-by-step procedures for removal of a nasogastric tube. Please be sure to complete the following steps prior to starting the procedure. You will begin with placing a towel over the patient's chest and providing them with tissues and an emesis basin. You want to, if the patient is hooked up to suction, you will want to clamp the NG tube. So to do that, we're going to fold the NG tube onto itself so that it clamps, remove the suction, and then place the white end of the plug into the NG tube. The next step that I will do is to check placement. So I will grab my syringe, clamp the NG tube, remove the plug, insert the syringe, pull back on the syringe until I see a small amount of gastric content in the NG tube. I can return that gastric content, clamp the NG tube, remove the syringe, and replace the plug. Once I've done that, I'm going to go ahead and start removing the pin and the tape that is securing the NG tube to the nose. I'm going to actually take and flush the NG tube with either 30 milliliters of water or 30 milliliters of air, whichever you prefer. But I'm basically doing this to clear out the NG tube so that when I remove it, no gastric content that's still remaining in the NG tube will come up and irritate the back of the throat or potentially go down into the lungs. So I put 30 milliliters of air into the NG tube. And I'm going to ask the patient to take a nice deep breath and hold it for me. Deep breath in, hold it, and I'm going to quickly remove the NG tube, coiling it up on itself, and then putting it into the towel. The patient at this point may need a tissue to wipe off their nose, or prefer to have oral hygiene performed to clean out their mouth. At this point, this completes the removal of an NG tube. Please be sure to follow these steps after completing the removal of an NG tube.